New research from the American Cancer Society is showing a startling shift in cancer trends. And here now to tell us more about these trends is Dr. Georgine Nanos, founder of the Kind Health Group. Dr. Nanos, thank you so much for being here. Great to see you as always.
Thank you, Teresa. Yes, it is great to be here.
I saw the report, and why are we seeing colon cancer in the news as far as headlines?
I know it's a very disturbing trend because across the board, most cancers we're seeing lower mortality except for this one. And it's now the leading cause of cancer deaths in men under 50 and the second leading cause of cancer deaths for women under 50. So this is a huge change. And one of the reasons is, well, there's a few reasons. The main thing is our diet. Our diet has really failed us. Our, enormous consumption of ultra-processed foods is a big part of this, and then lack of primary prevention and screening is a big contributor as well. So those two things together in our healthcare system right now, everything's focused on being reactive to care and not focusing on prevention. And so we have so many opportunities to actually screen accurately for colon cancer at a young age, but they're not happening because visits are rushed and there's no time and people can't get in to see their doctors. Plus we've got this combination of our terrible diet over the last several decades. So it's this real perfect storm.
Yeah, what is the recommended age to get a colonoscopy?
So that has changed a lot too. It used to be 50, but several years ago that was lowered to age 45 to accommodate for more screening for people. And a lot of people still don't know this, but screening should start, universal screening at age 45 for every adult. And the thing about colon cancer is it is one of these rare cancers where it takes a very, very long time to develop. It starts with a tiny polyp, which is a little growth inside of your colon, and they're usually benign, and they can develop into cancer over the course of 10 to 15 years. So we have this super long window where we can actually catch cancer before it develops into a malignancy, and we're not using it because of the lack of screening and lack of education around it. And so starting at age 45, colonoscopy every 10 years, that's the gold standard. But there are some other tests that you can do if you're really terrified of a colonoscopy. You can do an annual stool test and then a DNA-based stool test every 3 years. But the best test is the one that you're actually getting. And so the important part is to get screened and to make sure that you're on top of it.
That's pretty scary. So what are the symptoms? Because if more people are finding out that they're having colon cancer and they're learning that at such a late stage, what are the symptoms?
So that's the scary part. There are no symptoms of colon cancer until you're at that late stage, and it can just be vague bloating, rectal bleeding, weight loss, those kinds of things. Those are the main symptoms. But if you're waiting for symptoms, you're way too late. That means the cancer has advanced. And this is, again, a highly treatable, highly preventable cancer if it's caught very early. That's why screening is so critical. We don't have a lot of great screening tools for many cancers, but this one we've really nailed in terms of prevention and screening. We just have to actually get people aware that those tools are out there and to actually utilize them. People get terrified of the idea of a colonoscopy, but it's really no big deal other than, I always joke to my patients, other than the prep the night before, which is a little uncomfortable. The day of the colonoscopy is super easy. You lose a few pounds, you take a nice nap, and you feel great. So it's
Can you be under local anesthesia for a colonoscopy?
Absolutely.
Okay,
yes.
I'll go get one.
You're totally under. You're totally under for a colonoscopy. So it is not. It is a non-issue. It is something that everybody really should do. It's such an important part of prevention.
Well, with screening being recommended now at the age of 45, what if it runs in your family? There's family history of colon cancer. Do you recommend even earlier in your 20s or 30s?
Yes, so that's a really good point. If you have a family history and a first-degree relative, meaning a sibling or a parent who had colon cancer, you want to be screened 10 years before their age of diagnosis. So if your brother was diagnosed at 45, you get screened at 35. And that's really important. And those screenings tend to be more frequent, like every 5 years or even every 2 to 3 years, depending on the risk. So there's so much that we can be done. This is such a preventable cancer, and we have the tools to prevent it.
Dr. Georgine Nanos, thank you for being here, weighing in on the latest trends when it comes to cancer. We appreciate it.
Thank you.
Of course, we'll be right back.